Am I doing ERP correctly? This is a common roadblock I see every week in my private practice. I think it is a common struggle that people have who have anxiety and OCD. Today, we're going to talk about the three common OCD traps that people fall into and how you can actually outsmart your OCD and overcome this. Now, when we're talking about ERP, usually it's important that we go over the basics of ERP therapy. And so let's talk about what that means before we talk about the specific traps that we can fall into. So number one, ERP is exposure and response prevention. It's a specific type of cognitive behavioral therapy and is the gold standard treatment for OCD to date. What that involves, and it's a detailed process, right? It's something that we have to go through slowly. It's a detailed process where we first identify OCD obsessions and OCD intrusive thoughts. So you will go through and identify specifically what are the things that are repetitive and intrusive and, distressing for you. So we're going to go through those first. And once we have a good inventory of your OCD obsessions, then we're going to move on and identify what specific OCD compulsions are you doing. Now, compulsion is a behavior that you do to reduce or remove your anxiety, uncertainty, or doubt, or any kind of discomfort that you may be experiencing. And once we do that, then we can move towards exposing you to your fears. So exposure therapy for OCD involves exposing yourself to those specific obsessions and then engaging in response prevention, which is the reduction of using those compulsive safety behaviors. Now, common OCD response prevention will involve reducing physical behaviors, reducing avoidant behaviors, or reducing thought suppression. It's reducing reassurance seeking, reducing mental compulsions, and in reducing any kind of self-punishment that you're engaging in to sort of beat yourself up for the obsessions that you're having. And then what we do is the main goal is to get you engaging back into doing the things you love to do, getting you back to engaging in your daily life, your daily functioning, the things that you find pleasurable, your hobbies, as soon as possible. And that's the whole goal of ERP, right? And the important thing to remember here is that ERP therapy for OCD is greatly improved by adding in other treatment modalities such as acceptance and commitment therapy or mindfulness-based cognitive therapy, DBT, and meditation and medication. And I should have mentioned medication first because most of the science shows that that's one of the most helpful to really augment ERP therapy for OCD. So if you want to go deeper into that, I strongly encourage you to check out Exposure and Response Prevention School. We call it ERP School, where we show you the how. I told you right now, like what to do, but I'll show you how to do all of those steps. It's important that you do know how to do those steps and you're doing them in a way that's careful and planned. So that we're not overwhelming you and throwing you in a direction that you're not quite prepared for, you don't have the tools for yet. And so today I wanted to discuss 3 questions that come directly from people who've taken ERP school, and they're really trying to troubleshoot these 3 common OCD traps that OCD gets them stuck into. So let's actually get to the good stuff now. Trap number 1 is if I don't engage with an obsession, am I thought suppressing? So let's hear their specific question. They said, I know what you resist persists. We talk about that in ERP school. But I also know that obsessive thinking and worrying can become compulsive. Is it possible that I could be caught in both situations? And how common is this? So I want to really be clear here in what we're saying when we say to practice ERP. So when you have an obsession, when you have the onset of an intrusive thought or intrusive feeling, sensation, urge, it could be an image as well. When you have that, Your old way of dealing may have been to try and push that thought away with some urgency and aggression. Now, we call that thought suppression, and that's an avoidant compulsion. So, yes, this student of mine is correct. That becomes compulsive, right? But we also know if we go into the obsession, try and figure the obsession out, give it too much of our attention, we're also engaging too much with it in the terms of using mental compulsion. That too is a compulsion. So we want to see that these two things can happen. But when we have the thought and we observe that it's there, the obsession, we've noticed it's there, right? We talk about this a lot in previous episodes of Your Anxiety Toolkit podcast. When you identify it's there, and then you say, I'm going to let it be there and still move on to what you love to do, what you value, that is not resisting it. That is engaging back into what you find important and effective and valuable for your life. It's not avoidance. It's not thought suppression. Now, if you do that in a way where you're like, oh, I don't want that thought, I want to engage in what I'm doing. Well, yeah, now you're crossing into that reaction being with urgency and resistance. And anytime we're doing anything in a sense of urgency and resistance, well, yes, it may be becoming a compulsion, right? And what we're talking about here, the way to manage this trap, right, is to find a middle ground. And it often involves slowing down, being a little more thoughtful in how you respond. And that's often using mindfulness. Right? We talk a lot about mindfulness here in your anxiety toolkit, in observing, okay, this is happening. And I'm going to respond in a way without urgency. And I'm going to come back to what I'm practicing. That isn't thought suppression. It's also not avoidance. It's also not doing a mental compulsion or ruminating. It's what we call occupation. You're engaging back into what you need to be doing, right? Which brings me right to trap number 2, which is, did I expose myself to the thought enough? And I think these two are so close, but there's a nuance different that I really want to make sure we address here. So the student says, right now, when anxiety sets in, I divert my attention to something else to focus on my values. Beautiful, right? Then usually anxiety will wear off pretty quickly and I choose to move on. The problem is what happens next. So far, this is beautiful, just like what we said. They go on to say, my mind immediately points out the fact that I didn't quote unquote savor the anxiety or look it in the eye, right? And that they're doing that to prove that they're not scared of it or that they can tolerate it, right? And so they go on to say, OCD accuses that my diversion wasn't in fact occupation or being functional and effective, that it was avoidance and that I'm avoiding to deal the anxiety feeling that I have. And they then go on to say, this makes me more scared of the intrusive thoughts in the long run. So really, if we were to break this down, they had a thought, they responded really effectively, but then this is the trap. OCD will usually tell you there's a way you're doing this wrong, or there's a way that there's an additional thing you haven't addressed yet. It usually is like, yoo-hoo, I have more to say. Have you thought about this? Like it's saying, there's other things you should be worried about. And in this case, they've dealt with it really beautifully. But then OCD's come in and said, no, you didn't look at it long enough. You didn't face it enough. If you don't face it enough, well, then you're going to keep having this anxious feeling in the long run. And really, in that situation, all we need to do is practice exactly the same tools we use with the first obsession, which is to go, maybe, maybe not, but I'm not tending to you. I'm not trying to make this perfect. I'm going to move forward with what I'm going to do and allow the uncertainty that I may or may not have anxiety about this in the future, or I may or may not have looked my fear in the face enough, right? Remember here that OCD is always going to try and bring you back into doing a compulsion to try and get that uncertainty. And your job is to catch the many ways, or what I call with my clients, trends on how it does this. Look for trends. What are the ways that it consistently pulls you out of using effective behaviors and tries to get you to be using compulsions, right? If you can find those trends, then you can identify them as, okay, we know what to do when they come. When it tells me I'm not doing it enough, or I'm not looking at my fear enough, or I'm avoiding it, or whatever, you can go, I'm not tending to that. I'm moving back to my values, right? Which beautifully now brings us on to the final trap number 3, which is, how do I know I'm doing ERP correctly? This is a very common one. In fact, I have consulted with dozens of different OCD therapists, including the ones in my private practice. For those of you who don't know, I have a private practice in Calabasas. We have 8 incredible licensed therapists. We are constantly consulting on this kind of question, or these traps in particular. And it's often around, how do I know I'm doing this right? And it makes sense, right? If you're doing ERP therapy, you want to get better. You're here to get the job done. You want your life back. You're not putting in all this time and paying all this money and investing your valuable resources to just have a good time and waste it, right? You're here to get better. And so it makes sense that you're going to have some anxiety about how well you're doing it. And you're obviously wanting to do it well, like you're someone who is thorough and is invested. So it makes sense that you're going to have this fear. But this is the thing to remember. This is another trap of OCD to try and get you to go back to rumination, right? To try and figure something out. Here is the facts. No one does ERP correctly. You are going to do ERP and you are going to fall, and you're going to try again and you're going to fail again, and you're going to try again and you may fail again. That is a normal progression of ERP. I tell my patients all the time, you're not backsliding. Nothing is particularly wrong right now. This is just the normal progression that we get better over time. Just like when we're learning to walk, you stand up, you fall down. It's not like you say, I'm not able to walk, I'll never be able to do it. You get back up. You walk 3 steps, you fall down. Then you get back up. You walk 5 steps, you fall down. That's normal, right? We're not going to say to a young baby, like, oh, you're not walking correctly. This is bad. You're never going to be able to walk because you're not walking correctly. No, we're going to say to them, keep going, keep trying, just keep trying. And with time, those muscles will strengthen and you'll be able to stand up and do this work a little longer each time. But do not fall into the trap of OCD telling you it has to be done perfectly, and you have to do mindfulness correctly, and you have to do response prevention correctly, and you can't do any thought suppression or you'll never get better. That is another trap. And your job is to say, good one, OCD. Thank you for your input, but I'm still over here with the focus of not trying to engage in rumination and trying to get certainty, but to move towards my values, to allow fear to be there imperfectly, right? Imperfectly, knowing that it won't be perfect every time. You may engage in some compulsions. I'm going to keep saying that. That is not particularly a problem, right? Especially if as you're doing it, you're using your tools and you're doing the best you can. Try to just focus on doing 1 minute at a time and doing it as you can. And we're not here to do it perfectly, right? And at the end of the day, if you're someone who struggles with this thought, like, am I doing it correctly or am I doing it perfectly? You can just say, maybe I am, maybe I'm not, but I'm also not getting caught in that trap, right? So I hope that that has been helpful, right? To really get to know these traps. And for you, it mightn't be specifically these 3 common traps. It may be something a little different. That's okay. Your job is to catch these trends, the things that keep pulling you back into rumination, pulling you back into avoidance, pulling you back into reassurance seeking. Identify them, come up with another plan. Again, if you need more help with this, you can use ERP School. It's an online course. It's on demand. You can listen to it and watch it as many times as you want in your PJs. It's there for you to troubleshoot these issues. We have a whole bunch of modules talking about how to troubleshoot these issues, but I wanted to do this publicly because I knew a lot of you who don't have access to care are probably struggling with the same thing. So that's it for me today. Thank you so much for being here. I am loving talking with you about the nitty gritty of how this can, the real hard stuff. And I hope it's been helpful for you. Please do remember, and I say this at the end of every podcast episode, I'm going to say it. It is a beautiful day to do hard things. Do not let society tell you that you're weak or that you're not supposed to and it should be easy, because that's not real life. No, it's hard to accept that, but we can shift this narrative to a narrative where we can do hard things. We can see ourselves as strong. We can see ourselves as courageous, and we will do the hard thing because in the long run, we build resilience and freedom that way. Have a wonderful day, everybody, and I can't wait to see you next week.